Hello everyone, welcome back to GrowMed. So in this video we will be discussing the important topics, and this one will be the last video, okay? And I'll try my best to cover all the important things, the PYQs here from all the subjects, okay? So um this thyroglossal cyst is an important topic, and questions have been asked on this thyroglossal cyst, like it is a repeat topic, and questions are asked like clinical case may they will be describing these things, moves with agglutination, deglutination, and moves on trunk protrusion and midline anterior swelling. And they can also give an image in which they you can see a swelling present in the midline of the thyroid and near the thyroid. And this is the one liner asked that most common site. Okay, so one, two, three things can be described. Three things can be described in the clinical case. Okay, so this is the buzzword which you must find in the question, and whenever you see these things described in the clinical case, then go with the thyroglossal cyst. Then the complications are the infection, abscess, and when we do incision and drainage, it will cause the fistula. So this is also a PYQ asked that operation treatment of choice, cyst trunk operation for the thyroglossal cyst. Then moving on to some important ulcers and the skin cancers which are asked. So this is the basal cell carcinoma, and it arises from the basal cell. Okay, so the name itself says basal cell arises from the basal. So how does this appear? It appears like a pearly nodule, and you can see here the blood vessels and the rolled or raised edges of the ulcer, and this is important finding, so question can be asked on this. So the most common site is the nose, and investigation of choice to biopsy here. Management is the wide local excision. Then for the squamous cell carcinoma, arises from the prickle cell layer. You need to remember this one. Then this ulcer wala is very much important because you can expect a question from this ulcers. One question to pakka aayega hi aayega ulcer ka from the surgery. Okay, so they'll be describing the appearance of the ulcer, and they'll ask you which type of ulcer it is, and if it is raised irregular everted edges, then it will be due to the squamous cell carcinoma. Treatment same is ka bhi same ही है. And the marker, so this marker is for the melanoma. Okay, then HIV, so this Kaposi's sarcoma, this is also important and most commonly seen in the HIV patients, that is the immunocompromised patients, and caused by the HHV8 neoplasm of the endothelial cells. Okay, endothelial cells are involved in this Kaposi's sarcoma, and the characteristic feature is the purple macular papule lesion. Okay, so the lesions will be something like purplish color, so bluish and between bluish and pinkish color. Okay, so then it will be the Kaposi's sarcoma, and by looking at the appearance you can easily come to know which is basal, which is squamous, which is Kaposi's, and which is melanoma. So melanoma will be differentiating something between the black to brown color, and the pigmentation will be irregular borders and irregular pigmented regression. Okay, the marker of the melanoma are the HMB45, estin, and the vimentin. Investigation of choice biopsy. Treatment be same hai, and there are important things which you must know to describe the melanoma. That is the asymmetry. So it is not symmetric. The borders also, they are asymmetric. Then you can see color variations in them, and the diameter increases day by day. Okay, so these are the things which can be described for the melanoma. Okay. Then moving on to the macrophages, graft types, and the samoma bodies. So these are the important things from the pathology, and so these are the different various specialized macrophages present in the other organs. Like liver, it is called as a Kupffer cell. This was a PYQ. Kidney, they are called as the mesangial cells. Brain, microglia, placenta, Hofburg. So this was also a PYQ. Bone, osteoclast, and spleen, littoral. Then graft type. So this is also a repeat topic, and frequently questions are asked. So if self auto, if same species allo, like in the question things can be described like the mother gave the blood or the son gave the blood, नहीं मतलब कुछ भी डोनेशन, ऑर्गन डोनेट किया या फिर ग्राफ्ट किया, ठीक है. तो अगर सन ने दे दिया फादर को, दैट ऑल्सो विल बी द एलो, सन टू फादर और like that. Then iso means from the twin, and xeno means different species. Okay. Samoma bodies. So these are the various diseases in which you can see the samoma bodies, and you need to remember this thing because questions are asked on the pneumoma bodies. It is the concentric rings of calcification. So the calcification occurs in this ring like, and this is quite a famous topic. Then these are the various stains used in the patho, and this is the list. So which stain is used for what? Like the for iron we will be using the Persian blue, and for iron or hemosiderin. Then melanin, for melanin we will be using Mason Fontana. For lipid, oil, red, O, Sudan black, and all those things. Okay, so this Congo wala is important because this was asked in the question in the exam. And so yeah, this stains is important and you need to mug up this thing. Then antigen presenting cells, so this is also important. And uh, the questions are asked on specialized antigen presenting cells. Like for lymph node, it is the dendrites which act as a APC. Then for skin, Langerhans cells, tissues, macrophages, blood, B cells, and GIT mucosal cells. Then the collagen types. So the types and the diseases caused by the collagen, defect in those types, and where are they present. So the normal location. Like for example, type 1, it is present in the skin, bone, and tendon. So whenever there is defect, it will cause osteogenesis imperfecta. One important finding seen with this osteogenesis imperfecta is the weak bones and then blue colored sclera. Okay, so a child with weak bones, blue sclera, think in terms of the type osteogenesis imperfecta, defect in the type 1. Then type 2 may involve a cartilage and vitreous, and defect will cause chondroplasia. This chondrodysplasia, sorry, chondrodysplasia, because cartilage is affected ना, तो cartilage की defect होगी तो chondrodysplasia हो जाएगा. Then 3 may it will be arteries, lungs, and skin, and the defect will be causing Ehlers-Danlos. And type 4 basement membrane Alport syndrome. Okay, so these are the important things which you must remember. And also questions are asked like describing the clinical cases of these particular diseases, and they'll ask what is the deficiency, or they can just give the features and they can ask what is the diagnosis. Then the visual field defects, so this is important and from the ophthalmology, and you can expect a question from this one, and especially this bitemporal hemianopia. This one is a famous question. So image based question can be asked, giving the image and they'll ask you to identify which kind of visual field defect it is. Like in central scotoma we can see the central black spot. Then monocular, this one only one eye is lost. Bitemporal hemianopia, a most common cause is this pituitary tumor. So this can be causing this bitemporal hemianopia. So clinical case can be described with a female describing headache, and on examination you can see a tumor and these findings are seen. So what is the cause or what is the diagnosis ऐसा करके पूछ सकते हैं. Then this contralateral homonymous hemianopia is seen if there is damage to the optic tract. And also another important thing is bitemporal hemianopia, optic chiasma. So chiasmatic lesions will be causing this hemianopia. So like questions are also asked on the location, which location will be causing which kind of diseases if there's injury. Like the contralateral hemianopia, this contralateral and superior quadrantanopia, this occurs when there is. Okay, so this occurs when there is a damage to the optic radiations, and this one is also an important image. So this one will be occurring when there is damage to the occipital lobe where the visual center is located, and the macular sparing. So this is the buzzword, the macular sparing, which you must find in the question. Okay, then the tracheoesophageal fistula. So the question most commonly asked from this one is this most common type, which is the third type. And the questions are also asked, give what does type 1, 2, 3, or 4, 5 describe. So in the type 1 you can see that there is only an esophageal atresia. So esophageal atresia, blind pouch is seen for the esophagus, and a part of the esophagus is not formed. Esophagus, sorry. Okay, so esophageal atresia. Then in case of type B, there is a formation of a fistula between the trachea and the esophagus, as you can see here, and it will be the proximal. So the proximal is, see, esophageal atresia is there, along with that fistula formation is there. Okay, so it will be proximal tracheoesophageal fistula. Okay, with esophageal esophageal atresia. And then the third, which is the most common type, what happens in this is esophageal atresia है and distal tracheoesophageal fistula, formation of the fistula distal. And टाइप 4 में विच इज़ द टाइप डी, इसमें क्या होता है कि देयर इज esophageal atresia with proximal and distal TEF. So in the type D, you can see the proximal, there's blind pouch, and then the distal esophageal fistula as well as the proximal. Okay, so two fistulas can be formed in the fourth type, and the fifth type is the stenosis. Okay, so tracheoesophageal fistula with the stenosis with TEF. Okay, and these are the clinical complaints, sorry, clinical features, matlab complaints. Okay, so a patient can be having if he has this tracheoesophageal fistula. And most commonly, this question is asked in integration with the pediatric, describing a pediatric patient with coughing, choking, and then frothiness from the mouth. What is the cause? And also they can describe the coiling of the release tube in the chest itself. Okay. Then regurgitation of all the feeds and continuous drooling of the saliva. Okay, so this is the hallmark feature, drooling of the saliva. Then choking, coughing, and excessive salivation. This is a feature of this type 2. Then moving on to the vasculitis. So this is also an important topic, and you can expect a question from this vasculitis also. Okay, so the questions asked from these are like giving a clinical case. So mostly case-based questions are asked from this vasculitis. The most important which you must remember is this superficial temporal artery, and you can see features like jaw claudication and headache. Then the Kayaso's most common site is the aorta and young and narrowing of the blood vessel. Then medium and the small vessel. So this vaginal granulomatosis is important, and the hallmark feature seen in this is the lung cavitation, and on the kidney crescent glomerulus is seen. Then this is also an important finding seen with this vaginous granulomatis C NCA positivity or PR3 NCA positivity. So whenever you see these things positive in the clinical case, then go with the vaginous granulomatosis as the answer. Then polyarthritis nodosa, so it is immune complex mediated and type 3 hypersensitivity reaction, and you can see a fibrinoid necrosis in it. Then Kawasaki's disease, so pediatric patient में most common देखा जाता है unilateral cervical lymphadenopathy, conjunctivitis, skin rash and mucosal lesions. Okay, so finding described with this is a strawberry tongue करके describe करते हैं ना mucosal lesion. ठीक है, तो this is an important finding seen in the Kawasaki's disease. Then type 4 is the Burgess disease, again a repeat topic from the surgery as well as from the patho. तो इसमें क्या होता है कि यंग मेल्स होते हैं, स्मोकर्स होते हैं, सो दे विल बी कॉजिंग अ थ्रोम्बस एंड विल कॉज occlusion which will be causing intermittent claudication. Okay, so these are the important things from the vasculitis. Then moving on to the pulmonary embolism. So you can expect a question from this embolism also. So the classical case described from this is a DVT and prolonged bedridden, and then shortness of breath, and these features will be described. So what is the investigation of the choice? So डी डाइमर होगा एक, एंड व्हाट इज़ द डायग्नोसिस पल्मोनरी एम्बोलिज्म. ठीक है, तो यही वाला क्वेश्चन बहुत बार रिपीट हुआ है, पूछा गया है इन द एग्ज़ाम. सो आई थिंक लाइक अभी इतना हाई टाइम है ना एग्ज़ाम के लिए, बस 2 दिन बचे हैं, तो सबको ये पता ही होगा इसका आंसर, एंड सबने इसके बारे में पढ़ा भी होगा. सो द रिस्क फैक्टर्स आर लाइक द DVT, इमोबिलाइजेशन एंड हिप और नी सर्जरी. तो ये भी क्लिनिकल केस में डिस्क्राइब किया जा सकता है. Shortness of breath, then screening D-dimer, and on chest X-ray you can see Hampton hump. So a PYQ one-liner was asked that Hampton hump is seen in which of the following, and investigation of chest CT pulmonary angiography है ही, and you can see a saddle emboli here. So this emboli, if you are appreciating it here, this one, so this one is the emboli which is stuck at the trunk of the पल्मोनरी ट्रंक, तो मेन पल्मोनरी ट्रंक, एंड इट इज़ कॉजिंग ऑक्लूजन, तो जिसकी वजह से सडन रेस्पिरेटरी डिस्ट्रेस देखने को मिलेगा पेशेंट में. एंड द क्लासिकल फाइंडिंग सीन विद दिस इज दैट ऑन ECG यू कैन सी S1 Q3 T3 in case of the massive pulmonary thromboembolism. Okay, so these are the things from the embolism which you must know. Then aphasia, so this is also a repeat topic, and it is classified into Broca's, which is also called as the motor aphasia, Wernicke's sensory, conduction, and then global. So in the Broca's, these two are very much important, Broca's and the Wernicke's. And uh, Broca's also called as non-fluent because the language comprehension is preserved, means that due to the motor aphasia, the muscles of the tongue are not working properly, due to which the patient is not able to speak. But if you ask him to make the actions or ask him to write the things, then he'll write it and convey the message to you. मतलब कि patient is understanding the instructions and also following them. But in case of Wernicke's, what happens is that the motor supply is normal, but the sensory area is involved. So due to which the patient will not be understanding what the instructions are being given, and he will not follow it also. Okay. So this is the kind of changes seen in this Wernicke's Wernicke's aphasia and encephalomania, sorry, aphasia. Then the conduction में क्या होता है कि language is preserved, fluency is preserved, but repetition is abnormal, and in case of global aphasia, all the three things are abnormal. Okay. Then moving on to the pneumoconiosis. सो इट इज़ एन ऑक्यूपेशनल लंग डिसीज, आजकल इंटीग्रेशन विद द PSM, फिर पैथो में आता है, फिर मेडिसिन में भी पूछा जाता है, ठीक है, तो ये बहुत ज़्यादा इंपॉर्टेंट है. एंड फर्स्ट इज द सिलिकोसिस. तो सिलिकोसिस इज द मोस्ट कॉमन टाइप, एंड इट इज़ द अपर लोब ऑफ द लंग विच इज़ इन्वॉल्व. ओके, मोस्ट कॉमनली. देन चेस्ट एक्सरे पे यू कैन सी एक्सेल calcification due to the hilar lymphadenopathy with calcification, and snowstorm appearance can also be seen. Then so the clinical case described in case of the silicosis will be like a factory worker works in the cement or glass, shortness of breath, cough, and on chest x-ray eggshell calcification. So what is the diagnosis? You have to image बस दे देंगे eggshell calcification का, and you need to identify the image and then come to the conclusion that it is silicosis. Then asbestosis in industries like the ship industries, and lower lung is involved most commonly because these asbestos particles, so they are like heavier and they'll be involving the lower lobe. So an important pathological finding seen is the asbestosis of the ferruginous body. So this dumbbell shaped body, as you can see here, and this body is called as the ferruginous because it contains the iron. Okay. Then malignancy associated. So this is an important question. So questions have been repeatedly asked on this, like the types of the malignancy. So the most common is the adenocarcinoma, whereas the most specific is the mesothelioma, and marker of this mesothelioma is the keratin. Then on chest X-ray, you can see ground glass appearance. Please do not confuse with the chest X-rays, and in the question also read the question properly so that you do not get confused what is being asked. So eggshell calcification, then ground glass appearance, asbestosis. Then anthracosis, so black lung due to the coal, so seen most commonly in the coal mine workers. It is associated with massive progressive fibrosis. So this is an important thing. Bagasosis, so also caused by Thermog- Thermoactinomyces saccharide. So this is a kind of the bacteria which can cause this Bagasosis, and it another cause is the sugarcane. So question was asked like this one. See, this was a PYQ that worker in the cardboard factory comes with cough and shortness of breath. What is the diagnosis? It is the bagasosis. And how do we prevent it? We can prevent it by the 2% propionic acid spray. Then byssinosis in the cotton, and these are the other things. Pneumoconiosis. The three most important are this one, two, three, and this one, four. Okay. So these four are important. Then rheumatoid arthritis. So already I've discussed the complete thing on the rheumatoid arthritis in the medicine videos, so the revision videos. But as you do not have much time now, so quickly we'll discuss the important things which can be asked. So these are the important things that which joints are involved, and these are the important deformities seen with it. And rheumatoid arthritis RA factor positivity will confirm the diagnosis, and this can be given in the clinical case. Clinical case with the female describing all these things, and they'll ask you diagnosis. So drug of choice is the methotrexate. This is also a PYQ asked, and this or the other things like drug of choice in the pregnancy, and the next is the drugs for the symptomatic relief. Okay, so that's all from the rheumatoid arthritis, and these are the images which you must remember, because image based questions, actually play a very important role, and they will definitely help you to reach the diagnosis easily. Then leukemias and lymphomas, so already discussed in the patho video. So I think most of you have already watched that video, and if you have not watched it yet, so link will be given in the description box, so do watch that video also. And now we'll just quickly discuss the important things. The WBC's tumors classified into the leukemias and the lymphomas and the leukemias. So leukemias again classified into the myeloid and the lymphoid, acute and chronic based on the duration. So by the combination of these things, we can get a various of leukemias, like myeloid, acute myeloid leukemia (AML), chronic myeloid leukemia, lymphoid, acute lymphoid leukemia, acute chronic lymphoid leukemia. Okay, CLL, AML, ALL, and AML. Okay, so these are the important things from the leukemia, and this is the classification. So you need to remember the translocation as well, because in the clinical case, if at all it is given, then it will be easier for you to identify, and also it will be like, if one liner is asked, then it will be easier for you to mark the correct answer. Okay, then moving on. So ALL most commonly seen in the children, and the appearance is the flower cells. It is CD19 positive and TD positive. Then the CML, so this Philadelphia chromosome is a very important and favorite questions of the examiner. So Philadelphia pe chromosome pe you can expect a question in the upcoming exam. Then on bone marrow examinations, you can see blue histiocytes, Gaucher cells and collagen appearance. मतलब different stages पे, मतलब एक साथ में you can find various different stages cells. कौन सा था वो? Different collagen ना, सही है. Then lymphomas. So the two important lymphomas are the Hodgkin lymphoma and non-Hodgkin, and these are the classical findings seen with this. So the RSL जो है ना, this one is an image-based question. Important image, Ritzenberg cells, and these are the various types of these RS cells, like the lacunar. Lacunar में you can see a space, empty space here, and this is seen most commonly with the nodular sclerosis. Popcorn may you can see that the appearance is looking like a popcorn, and in the pleomorphic, so you can see that multiple cells in a single cell. Okay, so these are the diseases where it is seen predominantly, like popcorn seen in the lymphocyte predominant, then pleomorphic seen in the lymphocyte depleted. Then this Burkitt lymphoma, this is also a repeat topic, and this is the important image. Okay, so स्टारिस का appearance बोलते हैं इसको, and seen with the Burkitt lymphoma. So Burkitt lymphoma में an African child, then with the jaw swelling and staris का appearance, this one given. Then think in terms of the Burkitt lymphoma, and these are the important things others which you must remember. Okay, so hairy cell leukemia, then this is most commonly seen in the boys, and BRAF mutation is there, BRAF gene is involved. So bone marrow aspiration done by dry tap, fried egg appearance, and annexin 1. Then the CLL. So CLL most common type in the adults, and you can see B cells in it, and this appearance is called as a smudge cell or the convect girl appearance. So these are the smudge cells, and if given in the question, then easily you can come to know, right? तो smudge cells मतलब कि ऐसे वाली image है या बैठने वाली image, मतलब कुछ different type का. Okay. Then from the micro, these are the important organisms which you must remember, and also the important things is related, जैसे कि in streptococcus pneumoniae. So the questions are asked like, it is the lens shape, it is the capsulated, and this is the organism, how it looks, and image based question can be asked. This is a famous question asked from this pneumonia, Druckmann like or carom colony appearance on the blood or the chocolate agar. सी मैंने भी सी दिस थिंग ना, ये तो मतलब पर्टिकुलरली इसी के साथ दिखता है स्ट्रेप्टोकोकस निमोनिया में. इसके साथ में यू कैन सी थिंग्स लाइक कैप्सुलेटेड ऑर्गेनिज्म, देन लैंचुलेट शेप्ड, देन निमोनिया था पेशेंट को ऐसे करके, देन the answer will be this Streptococcus pneumoniae. Coiling reaction is seen and causes pneumonia, sinusitis, and otitis media. Then meningococci, we all know that causes meningitis, and it is also capsulated lens shaped. Ferments glucose plus maltose, and this is the thing which will help you to differentiate between the Neisseria and the gonococci. So Neisseria meningitis and gonorrhea. Here, then complication. This is an important PYQ asked that the complication is the bilateral adrenal hemorrhage, which is also called as Waters House Friderichsen syndrome. देन गोनोकोकाई सेम है, यहाँ पर नॉन कैप्सुलेटेड है. दिस फॉर्मेंस ओनली द ग्लूकोज. दिस causes sexually transmitted diseases and complications, perihepatitis, vasculitis. Then this chromoblastomycosis, so the copper penny body or the sclerotic, this is an important finding seen with this and most commonly seen in the forest workers. Okay, so whenever these things are described in the clinical case, then think in terms of this chromoblastomycosis and look at the image also, because image based question can be asked. Then Giardia limbia. So this is also a repeat topic and questions have been asked on its motility. So the falling leaf motility, and if at all described in the clinical case, you can easily mark the answer as this Giardia limbia, and it is a 4-pair flagellate and is racket shaped, causes diarrhea. So diarrhea patient with features like fever and all, ये तो रहेगा ही रहेगा. उसके साथ साथ में they will describe falling leaf motility. Then these are the 3 important dermatophytes which are asked in integration with the derma also, micro also. And the first one is the image of the trichophyton. So it is pencil shaped and involves all the 3 skin, hair and nail. All the 3 things are involved in this dermatophyte. Epidermophyton, it is a club of boot shaped and skin and nail. Only 2 things are involved, whereas microsporum, it is spindle of the fusiform and the skin and the hair are involved in case of this microsporum. Then moving on to the pericardial parasitic eggs. So I've already uploaded the complete video on this parasitic eggs with the name under the micro 10 most important topics. Like, don't miss these topics from the micro. So do watch that video for a more detailed video explanation of this parasitic eggs. So this first image H nana egg. Then second are the ascaris. So 2 types of eggs, unfertilized and fertilized. Then dilatum, this is the egg of the dilatum, and the differentiating factor is this lid which is present. Then the spine. So with the spine, you can also come to know which it is. So the schistosomiasis. So all these 3 are for the schistosomiasis. Mansoni, it is the lateral. Hemobicum, it will be having a terminal spine, and Japonicum, it do not have any spine. Okay, so these are the diseases which they will be causing. Then moving on to the next, that is the Enteromobius vermicularis. So this is a PYQ asked that it will be causing the perianal pruritus, and it is a T-shaped egg. Then this is an anistoloma duodenale. So enters soles and foot and causes ground itch. So this was also a PYQ. And then this was also a PYQ, the rectal prolapse in the children. So trichuria, this dumbbell shaped and is associated with this IDA, iron deficiency anemia. Okay, so these are the important parasitic images which you must remember. Then croup and this acute epiglottitis, I think everyone already know about it. Just once have a look on this causative organism, because I don't know exactly, it has updated and I feel that किसी का तो एक का hemophilus influenza कुछ तो है. Okay, so do please do look at the update, and if anyone knows about it, then please put it in the comment box. So these are the clinical features that can be described, and these are the important findings which you must remember. So it's thumb sign on X-ray, acute epiglottitis, steeple sign, and the treatment modalities also. And these are the X-ray images which can be asked in integration with the radio. So this is the थंब साइन एंड दिस इज द स्टीपल साइन. ठीक है, तो बहुत ही फेमस क्वेश्चन है, बहुत रिपीट किया गया क्वेश्चन है, तो अभी तक तो सबको पता ही होगा इसके बारे में. देन फॉरेन बॉडीज एंड ऑन द चेस्ट एक्सरे. तो इफ अ फॉरेन बॉडी इज इन द trachea, it looks something like this. So front से it will be looking by edge of the coin and lateral view में full coin दिखेगा. In case of the esophagus, laterally मतलब front में देखेंगे तो full coin दिखेगा and by AP view or the lateral view होना चाहिए. Lateral view में it will look like the edge of the coin. Okay, so these are the differentiating things between the trachea and the esophagus. Then moving on to, okay, so the inquest. So two type of inquest we do in India: police and the magistrate, and these are the important numbers for them, and these are the other things which you must remember from this inquest. So this is a PYQ, that if custodial death happens, then the judicial magistrate will be doing the investigations, whereas executive, uh, they will be doing the dowry death exhumation. Okay, then stains for the blood. So these are the important stains which are used to identify the blood and also to make the blood stain test. Okay, the spectrometric, these are the important things which you must remember. Like this is the most specific and confirmatory, because questions are asked like PYQs. Which of the following blood stains is the most sensitive and most confirmatory, most specific and confirmatory? So it is spectroscopy. Likewise, they can describe this thing. The pink purple feathery appearance is given. Pink purple नहीं, feathery नहीं, feathery वाला तो ये हो गया ना, Takayama. So this is an important image. Takayama wala is important. Salmon pink feathery crystal. But if you see pink and purple, then it is the Kestel Mayer. Then Tickman heme crystal brown rhomboid. So as you can see here, so this is the rhomboid, and this one is this ये वाला Takayama का feathery वाला, salmon pink feathery. Then Bittering test, most reliable, and microchemical for the RBC content. So if human blood in stains is identified with precipitating tests, this was a PYQ. And then these are the tests for the seminal stain. So Barbarius is a previous year topic and asked frequently. Then these are the toxins and their antidotes. Okay, so for lead we will be using the EDTA, iron desferoxamine, alcohol for mepizole, for copper it is potassium ferrocyanide, for cocaine amyl nitrate, opioids naloxone, and for cyanide sodium thiosulfate, these organic phosphate, and the snake bite. Okay, so do read all the things once again so that you do not miss any of these important points. Then from the psychiatry, so postpartum blues, depression, and the psychosis. So all these things have been already uploaded, explained fully in the psychiatry revision videos, and now we'll just discuss the important things. So postpartum blues is the most common variety, whereas the most severe is this postpartum psychosis. So these are the days when it will be appearing. So duration of the appearance, and these are the clinical features which you can see in the particular disease, and like clinical cases are asked. So by looking at the day and the features described, you can easily come to the conclusion that which is the correct cause, like blues or depression or the psychosis. Then these are the extrapyramidal symptoms. So these extrapyramidal symptoms, and these are the most commonly side effects seen with the antipsychotic drugs. Okay, the side effect of the antipsychotic drugs, acute dystonia is seen, and these are the treatment options which we'll be using. Like so the acute dystonia, this one is seen earliest. So earliest manifestation and treatment is the promethazine IM. So the cases are asked like a patient was on schizophrenia and you started him giving so and so antipsychotic drugs. After a few days he comes with the complaints of acute dystonia. What is the next step of management? So it will be giving promethazine. Or what is the cause of this manifestation, clinical manifestation? So you need to make the diagnosis acute dystonia. Okay, then likewise for acute ectasia, it is the beta blocker which is the drug of choice. Then treatment, and for drug induced parkinsonism, it is the anticholinergic or the Bexhexol. Tardive dyskinesia atypical or the clozapine, and then neuroleptic syndrome, it is the dantrolene. And this is the alcohol withdrawal syndrome and the symptoms. So which symptom will be occurring in which hour and which is severe, which is the most earliest. This is the earliest, this is the most severe, this is the seizures. Drug of choice is the benzodiazepine and treatment lorazepam plus the thymine. Okay, so this is about the labors, and already I've discussed the important things of the lasers in the labor in the gynec video. Okay, so the four stages you must remember that what happens in each phase. So phase 1 may be contraction with cervical dilation, full cervical dilation till the fetus head, delivery of the fetus, then fetus to the placenta, and 1 hour observation is the four stages. Okay, and these are the particular things which you must remember, like rate of cervical dilation and the rate of the descent, how much it is for how which category of the woman. Okay, and these are the questions on the presentation and the presenting part. Okay, तो ओबीजी आई थिंक सबको पता ही है यार, ये मतलब सबने भी पढ़ ही लिया होगा कि फेस प्रेजेंटेशन, सिफेलिक, शोल्डर, बीच, वो कब बोलेंगे और दोस थिंग्स. And this is also a repeat topic. तो pelvis है ना, classified into the four types. So female, android, फिर anthropoid, patipaloid. And ये भी मैंने 2-3 वीडियो में ऑलरेडी डिस्कस करा हुआ है इनके बारे में. And if you like constantly watching my videos and if you're रेगुलर विथ मी, सो तो अगर आप मेरे को रेगुलरली फॉलो कर रहे हैं ना, तो यू विल बी ईजीली का मतलब रिकॉल कर रहे होंगे आप अपनी चीज़ें दिमाग में जो भी मैं अभी एक्सप्लेन कर रही हूँ, क्योंकि ऑल दिस थिंग्स तो आई ऑलरेडी डिस्कस्ड इन द वीडियोज़. तो ऑप्स गायनिक की रिविजन वीडियोज़ में वी हैड डिस्कस्ड ऑल दिस थिंग्स. सो फीमेल विल बी लाइक राउंड पेल्विस, देन पेटिपुलॉइड ओवल पेल्विस, एंड्रॉइड में हार्ट शेप्ड विच इज़ द कैरेक्टरिस्टिक फीचर, मतलब ये इंपॉर्टेंट है हार्ट. फिर इसका एंटीरो पोस्टीरियर डायमीटर थोड़ा सा ज़्यादा बड़ा रहता है. ठीक है, सो ओवल, ये भी ओवल है. एंड देन मूविंग ऑन टू किलोइड्स एंड द हाइपरट्रोफिक स्कार्स. ठीक है, सो दिस किलोइड एंड हाइपरट्रोफिक स्कार्स आर इंपॉर्टेंट फ्रॉम द सर्जरी. अनकिलोइड हम कब बोलेंगे उसको, व्हेन अकर्स फ्रॉम द नॉन ट्रोमा साइट्स, एंड द मोस्ट कॉमन इज़ द अपर बैक और द चेस्ट. इसमें क्या होता है कि बियॉन्ड द लिमिट ऑफ द ट्रॉमा, सो इट ग्रोज बियॉन्ड द लिमिट, एंड दिस hypertrophic scar are limited to the initial wound, and it can be due to the trauma. Okay, then moving on to some chromosomal abnormalities. So these are the important chromosomal abnormalities which you must know. So this is the Down syndrome, and these are the features seen with this. So clinical cases can be asked describing all these features, and they'll ask what is the diagnosis, or they can just ask this image. They'll give this image and they'll ask which kind of chromosomal abnormality is seen. So it will be the trisomy 21. So depending on the options which are given in the question and what the examiner is asking, you need to uh, mark it as a correct answer. Then for the Turner syndrome, it is the monosomy, 45XO रहता है इसमें, and these are the features seen. And this Turner syndrome is also a repeat topic, so you can expect a question from this also in the upcoming July exam. So a clinical case can be described with a short height, then primary amenorrhea, normal IQ, and all these things. And there are what is the diagnosis. And this is for the Klinefelter syndrome. So tall and scanty pubic hair, infertility due to azoospermia, testicular atrophy, and gynecomastia. Okay, so these are the things seen with this Klinefelter syndrome. And now, important thing from the dermatology, that is the syphilis, chancroid, and the lymphogranuloma venereum. These are the causative organisms for each of the thing, and these are the ulcers. Which type of ulcers it causes, and this is the treatment. Like syphilis caused by the Treponema pallidum and the painless. So the genital ulcer are painless, and the lymph node are painless. Whereas in chancroid, the genitals are painful, whereas the lymph nodes are also painful. And in the inguinal bubo, the lymph nodes will be uh, painful and it will form a bubo. Okay. Then moving on to the next, that is the Bell's palsy. So Bell's palsy में you can see the motor lesions and classified into the upper motor neuron and the lower motor neuron lesion. तो दोनों के manifestations अलग होती है. In case of lower motor neuron, there is ipsilateral, half of face is paralyzed including the forehead. Ipsilateral मतलब जिस साइड में इंजरी होगी उसी साइड का पार्ट इन्वॉल्व होगा. इन केस ऑफ दिस palsy लोअर मोटर न्यूरॉन, तो लोअर मोटर न्यूरॉन में सेम पार्ट will be involved, whereas in the upper motor neuron it will be the contralateral, so opposite side will be involved. Lower face is paralyzed. Spanning of the forehead also occurs in it. So these things you need to look कि ipsilateral है, contralateral है, forehead involved है नहीं है, to come to the diagnosis कि किस टाइप के Bell's palsy है ये. Okay, and these are the clinical features associated with this Bell's palsy. So finally guys, we have successfully completed the PDF, and I did not explain things very properly, but I think as it is high time now and you all know about all these things properly. Okay, so it was just a quick recall to brush your memory and to brush your brain. Okay, so that's all in this video guys. All the best for the FMG, and hoping that all of you will be passing this exam is really good marks. Okay, stay tuned for more videos, and then yeah, that's it. So thank you so much once again. I am Dr. Padmini, your mentor for the FMG.